So thanks everybody for having me. I'll try to talk from both physician perspective, CMS, and private payer role, and now at Optum on these issues, and try to be brief. Um, so first, just as a practicing physician, the population that I care for is children with multiple chronic conditions, often that need longitudinal care, including for physical, mental, and social needs, and need that care in order to prevent hospitalizations, have a more robust life with better quality of life, et cetera. So how do we invest in a system that supports them? So that's sort of the first perspective, if you will. The second perspective from CMS, worked with my fam and many others at the CMS Innovation Center, testing new payment and service delivery models that focused on whole person care. At one point, gosh, it's getting older now. I think in 2013 or so, we wrote a paper with Neil Halfon about the opportunities and challenges of a lifelong health system. But really, to call out a few examples from the Innovation Center that I think are positive. One was work we did with states and state innovation models to really invest in new comprehensive care systems focused on better health outcomes for the population, a better experience, and lower cost. I call out models like accountable health communities, which tried to link the various aspects of health together in a community and have a funding model to support that. Lastly, a model that took a while, but as a pediatrician, we had the LINK model focused on children and how you invest in communities focused on children in terms of better health outcomes, preventing adverse child experiences and other outcomes that we know have dramatic negative long-term effects. So how do you prevent some of those issues? And then the core payment shifts to value-based payment, where we went over time from essentially 0% of payments in these advanced alternative payment models to over 30%. That was over $200 billion and over 200,000 signed provider agreements across the country. It's now at around 50%. And as Don Berwick said in the panel I was on with him not so long ago, the largest payment shift in CMS and Medicare, Medicaid history. And so learned a lot from that. I'd also call it primary care. We tried to make pretty major investments in primary care. A longer discussion for another day. I think our system had underinvested so long in primary care, we may have even sort of underestimated the amount of sort of dollars, resources, supports that were needed in primary care. Now, if you pivot to Blue Cross North Carolina, where at a private payer, we tried to, once again, invest value-based payment. We went from close to zero to over 50% of payments in advanced payment models in less than 18 months. That resulted in over 150 million in savings and growing. We invested in primary care with Aledade and others that are represented on the call to really invest in primary care, give them the tools, shift to a population-based payment system. And we invested in the social determinants of health. So, as an example, we had food insecurity for the entire state on our board level metrics, which meant it was tied to the compensation of me and everybody on our executive team. And it wasn't just Blue Cross North Carolina members, it was the entire state. And that was a cultural shift to get people to think about how do you broaden your horizon beyond just an insurance frame to a whole population health frame. We worked with Secretary Mandy Cohen and others in the state of North Carolina on that work. And then, mental behavioral, which we'll talk about in Optum. How do you integrate mental and behavioral into the whole person care? My role in Optum, I've been here 16 months or so now as CEO of Care Solutions. Just to give you a sort of lens on what that means, Optum in total cares for about 125 million Americans in some form or fashion, so large footprint. We have 20 million where that relationship is deeper. And then we have multiple millions that are in fully capitated and just full integrated arrangements. And I'll talk about a couple of those where we're wrapping around care, physical, mental, social. That'll lead to three areas in Optum I'll call out. One is home and community care, which is a set of businesses that report into me and get to work with the team. Give you an example. We just started working with Landmark, which is risk-based for primary care. We've had a program that we've been scaling up called Optimum Home, which is full risk for dual eligibles. It is expanding, doubling each year, year over year for the last couple. And then the results, most importantly, 95% of members are in 4-star greater plans now, based on quality measures from CMS. That is really uncommon in a duals population. Dual populations usually have much lower star ratings. The NPS of the program is in the high 80s in terms of the experience of the dual eligible members. And the total cost of care is down dramatically. So think 40% less hospitalizations, 40% less visits to the ER that are unnecessary. And it's all about wrapping care in the home, physical, mental, and social. The average engaged member we'll see in the home 9 times a year, in their home with an advanced practice clinician or a physician. So a really holistic care program. So that's our home and community work with one tangible example. We also do 2 million advanced practice clinician visits into the home every year all across America. Next area is mental and behavioral care, where all those businesses get to work with them. We provide behavioral benefits to about 40 million Americans. And what we're doing now is we're investing a lot more in the care delivery side of that. So how do we systematically provide treatment for depression, anxiety, substance use treatment, serious mental illness, both with assets we own, but also through partners. So, how do we work with City Block or others represented to deliver care? A company that we utilize is called Able2, which is one of the largest, if not the largest, virtual depression, anxiety, evidence-based treatment platform in the U.S. Where we're delivering, over 1 million cognitive behavioral therapy visits this year to people and integrating that back into their primary care environment. And then the last thing I'll call out, I also have specialty care and urgent care and a number of other businesses in classic Optum fashion. But the last area I'll call out is just our primary care investments, where we have over 55,000 physicians now. And, it's just a different model. It's not a fee-for-service model. It's a model where we say, we want you to care for a population of patients from multiple payers. We work with 4 out of 5 payers in the country, so 80% plus. And we want you to care for those patients and deliver better health outcomes, better experience at a lower cost. And the financial model supports that. And the clinical system, everything from data and analytics to decision support tools to, home and community resources we wrap around them, to behavioral resources that we integrate with those primary care providers. That's really what we're trying to drive each and every day. So with that, I'll be quiet and look forward to the discussion. Thanks for having me here.